We had other questions, but I'm going to focus on this one here because we're talking about diagnostics and collecting blood and urine. And we recently hosted Dr. Jennifer Granick, who's an internist, who talked to us about urinary tract infections. And for my colleagues out there, I would really encourage you to listen to this talk. It's quite good. But one of the things that she talked about was this phenomenon of subclinical bacteriuria. And for those of you who don't know what that means, it means you do a urine test, we see bacteria, therefore suggestive of a possible infection, but the animal does not have signs of an infection. And we know that this is a fairly common phenomenon. This article here reported upwards to 12 or 13% of healthy animals. We find that. And in those cases, treatment is not recommended. But in Dr. Granick's talk, I recalled that she showed this chart that showed that dogs with chronic kidney disease, upwards to 30% of them, may have subclinical bacteriuria. And so I wanted to ask you guys what your approach is. I'm sure you must see this in your patients. I think we could all benefit on what you all think might be a recommended course of action when bacteria are seen on a UA, but the animal has no signs.
Yeah, we probably all have different opinions. I'll start just because it kind of falls into the routine diagnostic part. So there's a lot of diagnostics we can do. And one of the things I didn't cover in detail is looking for that underlying disease. And the challenge here is if you find bacteria, are they subclinical or are they, meaning there's no clinical signs? That doesn't necessarily mean they're not important. And maybe the biggest challenge in veterinary medicine versus human is that the main clinical sign reported by people is pain, and our patients can't really describe that. So we always have this subtle question of, could we be missing clinical signs? Having said that, when I started practice, I actually used to check cultures regularly in my chronic patients. So I would test them at the beginning and I would test them periodically to make sure I wasn't missing bacteria. And I will say I have stopped doing that now. So if I have patients and they have relatively stable chronic kidney disease, I am not culturing, I'm not looking for bacteria in those cases. If I have a patient that is a newly diagnosed with kidney disease, I am usually going to talk about potentially doing a culture, particularly if there is evidence of inflammation or infection. If I have a patient that suddenly changes, so they go from stable to unstable, I'm going to be looking for bacteria. And what it boils down to for me is there aren't that many truly treatable causes of kidney disease except for infections. So especially in an acute patient, I'm always looking for and treating infection. In a chronic patient, I'm always asking the question, could there be an infectious cause here? And I do think, like I will say from that 30, my personal experience is that 30% seems really high for chronic kidney disease. I don't think we see nearly that number. I think it's more like regular dog populations. But I haven't actually tested my number. So maybe it's higher than I think. Certainly as we get older in cats, we see higher percentages. So my take on this would be, if they're brand new diagnosis and I'm looking for any possible underlying cause, I look for bacteria. And if it's there, I will actually treat it at the time of diagnosis. I don't look for it at any point after that unless there's an acute unexplained change in their disease. That would be my short summary, but I'm curious to hear what the other two say.
I'll jump in since I'm not muted and Autumn is, but I agree with all that. I mean, I being the old guy, we used to culture everything. I've written and spoken about how way back when in the late 80s, 90s, how you should do that with all of them. And as we've come to realize that this subclinical bacteriuria is not only not a bad thing, I know there's double negatives there, that it's not a bad thing. It actually may be a good thing because they may represent non-pathogenic bacteria that are just in the urine that aren't causing problems and actually may be protecting. So we look at it. I would also say 30% is pretty high. I think it depends also on how you collect your urine sample, who brings it in. Is it a free caught one that's overnight or something like that? So I think that would be, I'd have to go back and read the details of these. It's been a while, but we don't routinely culture. I wouldn't treat unless I agree with their unstable or something's happened, whether it's an instability in their creatinine or their clinical signs, being not urinary necessary clinical signs, but suddenly you've got a dog who comes in and not eating well, but his creatinine hasn't really changed. And I'm looking for what happened if it's not the dog's kidneys. So I agree all with that. I think the real kicker is we don't have a good way of telling, is it in the kidneys or not? Because that's always the concern. And if it's not in the kidneys, why would that be causing kidney issues? And the second is, even the presence of blood and white cells aren't necessarily indicative of this being clinical. The issue is dogs can't describe, like as you mentioned, and you run this balance between antibiotic stewardship and your individual patient. And so that, I think, is, until we come up with better ways of saying this is an infection and it's in the kidneys, and the clinical sign is the kidney values are worse, BUN and creatinine are worse, or estimate or something has gone up, or cystatin, then we just don't have that.
Yeah, I agree with everything that both Dr. Barges and Dr. Speck said. It will be interesting in this age of trying to come up with biomarkers that are active injury markers to see if that may be helpful in this situation where there may be patients with subclinical bacteriuria that then have elevations in these markers indicating there may be active damage versus others that don't. We just don't have the studies on that yet to know how helpful these would be for that.
Thank you all for that.